Thanks again, Kareem, and thanks to Medicus Mundi for arranging such a wonderful conference. It's such a, wonderful opportunity to talk about mental health, and that particularly about women's mental health, which is, I mean, we say that when it comes to mental health, every country is a developing country because we don't see mental health being addressed appropriately anywhere in the world as much as it is needed, and the dire impact it has on everyone's life. None of us can say that we don't have it or we can't have it. It's something which affects everyone. Every other family sees someone having mental health issues or minor issues, not necessarily having a major issues. But when it comes to gender, why are we focusing on women? It's important to know because women do get affected by mental health conditions more than men. A lot of especially common mental disorders like major depression and dysthymia, which is a long-term depression, not as severe as major depression, but it's a depressive state which stays for years. Both are twice as high in women as compared to men. Also, a lot of anxiety disorders, like generalized anxiety disorders, phobias, post-traumatic stress disorders, and many other anxiety disorders are also 2 to 3 times higher in women as compared to men. And we know that eating disorders are also disproportionately very high in female. So, though the severe mental disorders like schizophrenia and other severe disorders, they are kind of similar in men and women, but when it comes to common mental disorders, which are very common and affects families, not just women, but the whole families, their relationship with the partners, their children, and everyone are very, very common, particularly in females. So, what are the reasons? So reasons are, besides psychosocial factors like relationship with their family members, their partners, husbands, their in-laws, their children, workplace stressors, socioeconomic status. We know that in the large part of the world, women are not as financially independent as men are. So that also puts an increased burden. But besides that, there are a lot of risk factors which are very specific to women. For example, women has biological vulnerability due to hormonal changes and due to reproductive events that women go through. A lot of women face gender-based violence, for example, rape, sexual abuse, or domestic violence, or emotional violence. And they have extra responsibilities like caregiving responsibilities for their children and family members. These additional responsibilities and these additional biological vulnerabilities put women at higher risk of developing and sustaining mental health conditions. So when we say about reproductive events, so what are the reproductive events? We know that menstrual cycle every month causes hormonal changes in women. These hormonal changes causes a lot of mood changes for some, but for few women, it leads to post-menstrual dysphoric disorders, PMS we call it, PMDD we call it. So it has different name but for some women, it gets even more difficult to manage their daily functioning due to severe mood changes. If a woman goes through infertility, that is added stress, and not just stress of not having a child, but we know how much social stigma, social pressure, family pressure a woman goes through. And if a woman goes through pregnancy, then again, there are hormonal changes and women are more at risk of developing mental health conditions if they are under stress due to various reasons, plus hormonal changes, plus lack of support if they have a postpartum period. We know women go through postpartum blues, but for some women it goes to postpartum depression, postpartum anxiety, and even postpartum psychosis. At the later stage, when women go through menopausal transition, perimenopause, that is also again a time period when women go through a lot of hormonal changes And those changes also sometimes lead to severe stressors, pressures on women. And a lot of women face many emotional changes, depression, anxiety, because of hormonal changes, also the changes that goes through that they're going through at this point in time. A lot of women also take hormonal therapies to deal with these challenges, and those hormonal therapies again uh, causes various mood changes. So why should women's mental health be any different? So besides prevalence of common mental disorders that are very common in women across the life cycle, from the beginning of menstrual cycle to the menopause, the burden of mental disorders such as depression and anxiety fall disproportionately on women on childbearing and child rearing age. So that this time period, which is very, very critical for women when they become mothers, when they're becoming mothers, or when they're taking care of their children, that is the time which puts women at higher risk of these mental health conditions, which we call depression, anxiety, or common mental health disorders, and which affects their own well-being and the child well-being. So what is the situation? The situation is that in low and middle income countries, women at antenatal time point in pregnancy, 15% women approximately are found to be depressed, and 19% postnatally, which is 1 in every 5 women. And in high income countries, it is around 10%, 1 in every 10 women, and postnatally 13%, which is also very high. And up to 20% of these mothers who are depressed antenatally or postnatally, they experience suicidal thoughts or undertake acts of self-harm. We have heard of a lot of cases of women attempting or committing suicide at postnatal period or harming their children. This is because of the depression or other psychosis or mental health conditions they are going through at this stage, which needs to be taken care of. And if we know that if it is ignored, it can cause to serious conditions, even to the level of self-harm. So what is the impact, as we briefly talked about? That it's not just depression and anxiety, it also causes poor obstetric outcomes. What do we mean by poor obstetric outcomes? Women can have difficult delivery, can have challenges during the childbirth, can have complications related to childbirth, can lead to suicide, as we talked about. And the mental health condition can also become chronic and recurrent. If it is not treated, if it is not paid attention to, it can become a long time permanent major depression, a kind of situation which stays if it is not treated, if it not supported and not handled. So it can go for a long way. It's not a temporary thing. And mental health condition in mothers is associated with low birth weight in children. So the mothers who are depressed during pregnancy, studies have shown that the children are born with less weight. They are born earlier, so we have immature births. They are malnourished in the childhood to the level of stunting. They have more physical illnesses like diarrhea. Studies has shown that in developing countries, particularly, children of mothers with mental health conditions have more diarrheas, more physical illnesses, which further leads to malnutrition and stunting in those children. And so, children of mother with the mental health condition have more emotional and behavioral problems. Mother are since not able to take care of themselves and their children. The child is less likely to get vaccinations, and mother is less likely to get more antenatal or postnatal care because she's not able to take care of herself. She doesn't feel like taking care of herself, and there is problem in the attached mother and child attachment as well. So usually in mothers who have depressed, studies has shown that the bonding between the mother and child that is needed for the better child development is not as good as it could be if mother feels well and happy. So there is challenges in the bonding, there is less stimulation for the child, which is very, very important for the child development. And then further risk of developing depression in children. It child can have childhood depression, and such children also have higher risk of developing depression later in life, and that also has poor prognosis, means that they don't totally have the risk of developing depression later in life, but that child also has less likeliness of getting better or feeling better. And that we are talking about mental health conditions in general. And now we have added challenge of COVID-19. And we know that any adversity, any challenge, be it a pandemic, be it a war or humanitarian situation, any such situation, any adversity, any psychosocial or any physical adversities increases the chances of developing mental health conditions. So now the situation is that if people have or women have pre-existing mental neurological any disorders, plus if it has COVID pandemic, which has led to a lot of specific COVID-19 related stressors like losing job, isolation, added responsibility of childcare. A lot of women were not able to get the childcare due to lockdown, and they were not able to access social support because of the isolation and lockdowns. They were not able to access physical care and psychosocial care, which they might have been able to receive otherwise. All these added pressures, all these added adversities has increased the risk of developing mental health condition and sustaining it because of the lack of support, lack of services. So what the studies tell us that pregnant women assessed before the onset of COVID-19 reported significantly higher rates of depressive and anxiety symptoms than women assessed before the pandemic. So after the pandemic, it increased significantly. So much so that one study reported 33% of women had clinically elevated symptoms of depression, which is pretty high. And one of the risk factors, along with other risk factors like losing job, financial burden, having additional responsibility of childcare, managing home and family members due to lockdown, loneliness was additional risk factor. And all these specific adversities and increases internalizing symptoms, means not being able to share, not being able to express, and blaming oneself, feeling guilty about it. With all these things, the challenge that we have is the mental health workforce. The care providers who can provide us services for mental health care. We know that across the regions, the mental health workforce is not adequate anywhere. I mean, though it seems that it's pretty high in Europe, but if we look at really in the European countries, and if we talk to people in European countries, it's not as much as it is ideally should be even within the European region. But if we look at, besides European region, if we look at other regions, for example, African region, there is hardly any mental health services that is available. So what about the women world over who go through these conditions, where they are going to go, what they are going to do? That is a huge, huge challenge that we all face. So we discussed that lack of a skilled human resource is a key barrier, major barrier across the world, across the region. And besides that, there are challenges of financial constraints. Not everyone has medical insurance available. Medical insurance does not cover mental health in every country. So that is a huge challenge. Then women face logistical challenges, for example, transportation in access to mental health care, who's going to take care of the child if she goes for accessing mental health care. So women has these additional logistical challenges. Stigma and discrimination, huge thing. If people come to know that she's accessing mental health services, what implication it's going to have in her marital life, for example, especially in developing countries. I did my doctoral thesis on depression in women in developing country, and that was a huge thing which came out. Some women who could manage, they came without informing their family members, if it was possible for them, because some women were afraid that they might get divorced if the in-laws would know that they are accessing mental health services or they have mental health services. And some women could not continue or could not come for follow-up because it was difficult for them to hide, or there was no one to take care of their children, or they had challenges with the transportation, or they were not allowed to go alone to access the services. And that we are talking about pre-COVID situation. And now COVID has, complicated that further. And in European countries, when I work in European countries where we have better laws, the challenge is that if a woman is found in certain countries, not all countries, but in certain countries, there are rules that if the mother is not capable of taking care of children, the state takes away those children. So there's fear that if they go and access the services, if they reveal that they have mental health condition, there's concern, there is fear that the children might be taken away. So they don't want that. So that is another reason that the women don't talk about their mental illness, that they don't access mental health services. So these are a few challenges only, really, but there is a long list of challenges. But having no one to take care of, lack of skill, human resources, stigma, not having the agency, financial constraints, these are like huge, which really covers all other barriers. But we have some opportunities as well. The opportunities or the good news is that there are interventions that can improve women mental health or maternal mental health as well as child health and development. There is emerging evidence that mental health interventions can be integrated into primary healthcare level, and community-based interventions can be provided, which can be provided both by specialist and non-specialist. So that can take care of the challenge of not having really skilled human resources in large numbers. And the researchers have shown that these non-specialist delivered interventions are not just effective, these are cost effective as well. So these can be used world over, not just in developed countries, but also in developing countries, because it doesn't cause that much of a huge cost, and it's also effective. So these are the good news that we have. So one such program is the Thinking Healthy program that WHO has introduced. Thinking Healthy manual is available freely on WHO website. It's a cognitive behavior therapy based intervention, which can be implemented by community health workers or any lay workers, peer volunteers for mothers with depression and their infants. It was tested in rural Pakistan, Bangladesh, India, and many other countries, and Peru. In many other countries, it's being tested and utilized, and it's being scaled up, and it has been found very acceptable. It has provided very good results. And the good thing is that even the cost estimate that the cost effectiveness studies has identified, that the additional investment of just 0.1 to 0.2 US dollars per person per year can be added to maternal and neonatal child health services. And that can provide such a huge support and prevention and promotion of maternal mental health. So this is one program that WHO has introduced, which helps mother. Let me explain. Cognitive behavior therapy is a therapy which helps mother in thinking, change their thinking pattern. So helps to deal with their thought patterns, and also helps them bringing changes in their behavior so that they feel better about themselves and feel better about taking care of their children in general. And it has proven to improve both women's mental health, mother's mental health, and the child health and development. And it's developed with pictures. It has a lot of pictures. It has very simple language, and it has been translated in many languages as well. So I would encourage people to look at it, to use it where it's needed, and integrate it wherever it's possible. So studies have also shown that not just Thinking Healthy program, but also other programs, simple programs like we have Problem Management Plus and Interpersonal Therapy Plus. These interventions can be integrated in the healthcare system. We have a lot of evidence for it, and both from developed countries and developing countries, which is a good sign. So it's no more an excuse that we don't have resources, and we don't have human resource or financial resource for that matter, because the studies show that these interventions can easily be integrated into general medical visits for women, immunization visits for children or mothers, antenatal visits, postnatal visits, under 5 visits, or even home visiting teams can use those interventions. We provide those interventions. So there are a lot of avenues, which is very, very helpful. So WHO really has provided guidelines for including maternal mental health care within the child development programs, child care programs. And also we are going to publish soon to integrate into prenatal and postnatal care program. Also, the guidelines are going to come up to integrate mental health care within that as well. And we have also developed a MH Gap intervention guide, which also provides simple steps and simple interventions to provide mental health care about various mental health conditions, including maternal mental health, epilepsy, child mental health, etc. Okay. So another intervention that I talked about is Problem Management Plus. That is also a multi-component behavioral intervention. So that can also be used. It has been also tested in various regions, particularly lower income countries, but also being used in developed countries as well. There is interpersonal therapy and many others, which you can check on WHO website and contact us for it. So that is available. So these are very few things that can be done. So the key thing is that women's mental health services are essential component of essential health services. So as much as women need care for their physical health, care for their pregnancy, their child, as they need mental health services as much. And wherever possible, it should be integrated into general healthcare and maternal and child care programs. And it is possible. We know that the research evidences has shown that it is very much possible to integrate it into the health system, and it provides us tremendous benefits of it, both for mother, children, and the families. And non-specialist delivered interventions are effective and cost-effective and benefit both women and the child. Impact of pandemic COVID-19 has been substantial, particularly for women. We know that they have additional burden, additional responsibilities, additional stresses, but it is also an opportunity to prioritize mental health, including women's mental health, to build back better community-based mental health services. Some of the greatest achievement of mental health we have achieved during last decade has been after emergencies, earthquakes, tsunamis, etc. We can take this pandemic as an opportunity to integrate mental health into the general healthcare system and make it as essential as general healthcare. And with this possible, and that also helps in reducing stigma and discrimination, since women doesn't have to go to specialized care services. So these are the key messages for the brief presentation. Thank you so much for your kind attention and listening. I'll be happy to take any questions. Thanks a lot.
So, I'm back again. Fantastic, Fatima. Thank you so much for this wonderful presentation. I was wondering, because we will do the Q&A session with you now, has COVID-19 put us back on the agenda for mental health, or has it actually accelerated, or how do you say, put it more on the spotlight? Or how do you see the situation?
It has really put a spotlight on the need to mental health across the life course, actually, because more and more women and more people have realized the need for psychosocial support and mental health support. Because mental health, people have gone through a lot of stress because of COVID-19, whether someone in their family was affected of COVID-19, there was so much fear and anxiety of getting infected, getting any family members infected, losing family members. A lot of people lost their family members. So that has been a huge stress. A lot of people has lost their jobs. So financial stress. A lot of people were not able to, due to lockdown, children were at home. So the children were, stressed out. They were not able to see their friends and family members. So taking care of children, handling their emotions, was another stress on parents, particularly on women. And women themselves, there are studies of how much, domestic violence increased due to during the lockdown. So all these stresses has really put a spotlight on the need to mental health. The good thing is that there has been a lot of efforts to address this as well. A lot of people have realized, there has been a lot of studies coming out. There has been digital interventions providing online psychosocial support through phone and internet as well. But we know that these opportunities are not equally available across the world. Even in the developed world, we know how much we need to improve on those areas. So it has really put a spotlight, and that's why we say that let's take it as an opportunity to really build it. Now that we know that it's such an important part, and just that having any adversity like COVID pandemic can increase mental health condition to many fold. And the studies, as I shared the data, that it has really increased maternal mental health depression, women mental health, common mental health conditions to many fold in across the world.
There is someone who wrote one key issue is cultural perspectives to mental health. In this case, community interventions have a great chance of adapting and being sensitive to culture to increase uptake of mental health support services. And that's so true, because every culture sees it a bit different. There are patients coming in with headaches, and you would treat them here in Europe a bit differently than if someone goes to the clinic with a headache in Africa. How do you see the perspective, the cultural perspective in this?
That's a very good comment. Thank you for this. And this is really important. So when we develop interventions and we provide it, it's always comes with the recommendation to adapt it to the cultural context, because every culture has its own, minor nuances, which are very important to understand and adapt to it. So that is really important. And if the interventions are really culturally adapted, it has greater chance of being accepted and being scaled up. So when we use, as you rightly pointed out, that the terms used, for example, even for the terms used are very different in communities. People don't want to hear mental health conditions in a lot of places. So we have to talk with symptoms rather than, using any diagnosis. So we recommend using symptoms or general words, not using the labeling words or diagnosis in particular, and using simple words, not the complicated words, because we know that general communities, then not everybody are familiar with the words. And besides words, what kind of intervention is, is comfortable for them? They'd be happy. Like, for example, women in rural areas in Asia and Africa, they really like group interventions, because besides psychosocial interventions, it's also provide them a support network. And we have found that in certain places, I was involved in some interventions, and we found that it was really nice to see that even after the group sessions ended, after a 3 months, group intervention, they continued meeting, and they continued providing support to each other, and the anecdotal feedback that we receive from them. And it also provides us opportunity while communicating with them as to what is appropriate for their culture and their context. So it's really important to really adapt to the culture and learn about the culture before really taking those interventions there. Absolutely important.
Yeah, it's really an important question and comment. If there is no other question, I would like just to ask you to give a final statement on mental health. So what needs to change within us? What can we do in order to drive more or to do more for in terms of mental health?
Number one, we need to talk about it, as you are doing. You are putting a spotlight on it. So we need to talk about it. We need to encourage women to talk about it, to come forward. And more important is that we need to integrate it in our system. Um, with talking about it, supporting each other, and integrating into system, we can help reduce the stigma and discrimination, and we can highlight that mental health is as important as physical health, or in some cases even more important, actually. So we really need to highlight the importance, build it into the health infrastructure system at every level, in general health care, in child health care, in maternal health care, at every level, so that women does not have to worry about go to and special healthcare services at special care. They don't have to worry about the stigma and discrimination, and it's easier for them to access. And if it's within community, that's the ideal situation. So they don't have to go anywhere. So community-based healthcare services through peer workers, through volunteers, these can be integrated within the healthcare system. We know we have huge community health worker systems in a lot of countries. We can really tap into those. And we have trained community health workers, peer volunteers, mothers to support other mothers in the communities. And we are also testing digital interventions. So now with the digital technologies, we have some platform like Zuri and stuff. So we are testing, developing, and providing digital interventions for mental health as well. So using as many avenues as possible, talking about it, building it into the system, building it into our life, to talk about mental health, to use mental health services as a norm. That is what is needed to support really women. And we say women, it's not really women if you look at it. And even the families has come to us after the interventions. The males come to us, even the rural areas. They were so thankful that their whole family life has changed with the mood improvement in the mothers, the women. The whole outlook of the family, the environment of the family changes, the health of the child changes. So it's really investing into the next generation. It's really investing into the whole nation. So it's really needed to really weave it into the systems as much as possible.